show of hands, how many in the audience have somebody in their family who have diabetes? Raise your hands, please. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, and I think there might be, 30 people here, 40, out of which 12 people have diabetes in this family, right here. And this is about the incidence of diabetes in India. It's the diabetes capital of the world. There's no other country who has so many people with diabetes. So I recall the days when I started my research on diabetes at Lucknow Medical College, gastrointestinal observations in diabetes. Professor Kuan was guiding my thesis. The hospital was 3,500 beds. That's the number of beds King George's Medical College, Gandhi Memorial Hospitals had the beds. And I made a tour every day at night for 18 months. I could only find 162 cases. So people started asking me, why are you taking diabetes? There is no patient. There is no patient, you're wasting your time. But I had the wisdom of my professor. He said, Suman Mishra, if you know diabetes, you know half of medicine. He told me this in 1962. And look at what the situation now. 30% of the hospitals, beds are occupied by diabetes patients. 30%. And they're cardiovascular, heart disease, kidney patients. So, I want to be able to see the slide.
स्लाइड से नहीं दिखेगा स्क्रीन पे स्क्रीन पे दिखेगा
कहाँ गए भाई?
या तो वो लैपटॉप में है या तो लैपटॉप पे वहाँ बैठ जाइए सर तो आपको दिखेगा
कहाँ गए?
आ गया
अरे भी जाइए नहीं आपना यहाँ डॉक्टर बैठे
वही तो नहीं आ पा रहा नहीं आ पा
और नहीं ये लैपटॉप यहाँ नहीं आ जाएगा तो आप ऐसा कभी
And use of SGLT2 inhibitors in diabetes is beneficial for kidney disease, cerebrovascular and cardiovascular disease. I remember in 1962, when we started taking care of patients with diabetes, we didn't have the finger stick blood sugar. We used to have Fenin solution and we used to have a test tube and put 8 drops of urine and heat it up on a spirit lamp. And it will turn into orange, red or green. And you could tell how is the control of sugar. If I did the blood sugar in my office, in the hospital, we'll tell the patient, come next month, I'll give you a blood sugar reading. A month later. So we used to control the sugar in the urine. That was the main way of treating diabetes. Now today I'm going to talk about something entirely different. How to put the sugar in the urine to treat diabetes. So the next slide. Diabetes, I don't want to read the whole slide. Productivity, yes. So here, I'll move around. See the diabetes risk for, increases the risk for premature mortality. I run a hospital and a school in India. 35-year-old teachers having heart attacks and they have to quit the job. And it's very sad. So premature. You have something, a light source, so I can show you. Okay. Premature mortality. It causes premature death. I remember I used to tell the patients, your lifespan is reduced by the duration of your diabetes. So it was very bad. and estimated $9.8 trillion is wasted per year because of sickness and work loss from people with diabetes. It's a major problem. This prevention is cheaper. Next please.
आगे बढ़ाओ, एक आदमी बैठ जाओ, एक आदमी में ही बैठो।
So, how do I say that you should prevent diabetes? You have to find out what the diabetes, who has diabetes. So, check once a year at least, family history positive patients, people who have more than 25 BMI. You know that BMI, I don't have to explain. It's a ratio between height and weight. Habitual physical inactivity. People who are sitting on the computer all day, very prone. Race, ethnicity, previously identified impaired fasting blood sugar. Impaired fasting blood sugar means more than 100 fasting blood sugar. Impaired fasting. Or impaired postprandial glucose tolerance. We'll come to that more later. Patients have hypertension. They should be checked for diabetes. If they have lipid disorders, they should be checked for diabetes. History of gestational diabetes. If they produce children more than 9 pounds of weight, the mother should be checked every year after that to check for diabetes. Polycystic ovary. They mainly found in ladies. They have extra hair in the body, they are obese, and they have cysts on their ovaries. Next please. So you need to test the fasting overnight or drink 75 grams of glucose, and the blood sugar is checked out fasting and 2 hours postprandial. So there are 2 ways of checking for screening for diabetes. One is by doing a blood sugar fasting and giving them a drink of glucose and checking the blood sugar 2 hours later. The other is to do hemoglobin A1C. That tells you overall picture of 3 months. So the readings are given here. If you have pre-diabetes, then you should be checked every year. Next please. So hemoglobin A1C, the normal is below 5.7. If you have that, you don't have diabetes. In general, if it is between 5.7 and 6.4, diagnosed as pre-diabetes. If it is more than 6.5% on 2 separate tests, that indicates diabetes. Next please. So the annual screening should be done. This is how you prevent diabetes. You should be checked periodically. Lifestyle modification. Don't wait to get diabetes and then try to prevent it. So lifestyle prevention, what does that include? It includes yoga, it includes meditation, regular exercise, half an hour walking every day, 150 minutes a week of moderate exercise. That means, what is moderate exercise? Moderate walking. That means you cannot sing while you are walking, but you can talk. Very simple definition. If you can chat, it's okay, but you cannot sing. If you can sing, that means you are not. So, intermittent fasting. Lose 5% of your body weight. You don't have to be normal weight. Whatever weight you have, lose 5%. Intermittent fasting. Now this is something I want you to really understand, because this really works. You eat a delayed breakfast, brunch. Don't eat anything till 10 o'clock. No breakfast. Just have early lunch. 10 o'clock, nothing to eat before that, water. And after 6 o'clock in the evening, nothing to eat. Only eat between 8 hours. Tell your parents or whosoever is overweight in your family, they can do that without medical supervision. So 8 hours of eating. Stress reduction. Now please get your pen out and a piece of paper and write down what I have on the board. Because you cannot keep it in your head, everything I'm telling you. So go to YouTube. All of you log into the YouTube right now. When you log into the YouTube, and then you look for Pranayam Suman. Suman is my name, and Pranayam is the title. So you'll see my video there on the YouTube, 30 minutes. You will see it's something which I have recorded, which is very useful for senior citizens, for people who cannot do, not young people, but everybody can do. And this is not my invention. Subhay Banaras. It's done on a Sikh heart for the last 5 years. So I have translated that for everybody. People all over America are watching this, so you'll enjoy it. It will. How does it work? It teaches you 8 times of pranayama. And if you control your breath, you control your mind. The mind calms down. The stress reduction is very important, moderate activity, and of course, if you're diagnosed as pre-diabetes, you take metformin. Next please. Now, this is very important. This should catch everybody's attention. This cheetah is our model for intermittent fasting. Why do I say that? This cheetah only eats once in 3 days. Can you imagine that? He does not eat, he does not kill anybody unless he is hungry. And only eats when he is hungry. Once in 3 days. Very lean, muscular body, no fat. He's very fast. He eats 3 kilos. 3 kilos of meat every 3 days. For 72 hours, there is lipids are burning, different metabolism. And we'll come more to that. Next, please. So, there is very high incidence of heart attack, coronary artery disease, renal disease. Number 1 cause of end-stage renal failure is diabetes. Heart attack, very common. Angina, silent heart attacks. Cardiologists will teach you that. So they are very common. So what is the cause? Generally they are saying poor diabetes control. Poor diabetes control, because if you do it, I have taken care of patients who got gold medals from Jocelyn Clinic. 50 years of diabetes, no complications. They get really gold medal. So it can be done, but if we don't know, we don't have books to educate the patients about diabetes. There is no education going on. The family doctors don't have time. So multifactorial prevention. You control the A1C, keep it below 7. American Association of Clinical Endocrinologists says keep it below 6.5. Blood pressure control, 130 by 80 and less. Lipid control, weight control, regular exercise. Exercise for type 2 diabetes is the best way to reduce the weight. This talk will highlight the role of SGLT2 inhibitors on improving the control. So, next please. Now let's talk about SGLT2. Now this is where is our Ayurvedic friends? Are somebody sitting here? Yes. You will enjoy this. A French chemist in 1835 discovered fluorescein from the bark of the apple tree. Apple is very common in America. And the German doctor used it in high dosage to lower the blood sugar by producing glycosuria. At Jocelyn Clinic walls in Boston, Madhumeh is written there from Sushruta, because he tasted his urine and it was like madhu. So that's how it's called Madhumeh. So this effect of treatment by glycosuria has been used long time ago, but nobody wanted to do it. It was initially used to reduce fever. Next please. So So there is more history here of discovery of different steps involved, molecular level, gene level, new idea of glucose transporter called sodium glucose corresponders or SGLTs. They were found in the urine, in the kidney and the intestines. And both are responsible for glucose transport in the kidney. Next please. Can I get a little water please? So SGLT2 inhibitors, also called glyphosins or flozins, are a class of medication that modulate glucose transport protein in the nephron. SGLT2 inhibitor that perform a similar function in the intestinal mucosa. They are found both places. The foremost metabolic effect of this is to inhibit the reabsorption of glucose in the kidney and lower the blood sugar. They act by inhibiting sodium glucose transport. Next please. So, I was present in this presentation when Dr. DeFranco, very famous endocrinologist, he presented this paper saying that you leak the sugar in the urine and the blood sugar will be controlled. I said to him, you're crazy. All my life I have spent how to reduce the sugar from the urine. And now you're telling me to put sugar in the urine to treat? No, it took me long, not just me. The endocrinologist did not want to accept this. So it took a long time. But once it caught on, now it's taken off. Next please. These represent a promising approach, treatment of diabetes. They have the potential to be used as monotherapy. It does not have to have multiple drugs. Because their mechanism of action is independent of the beta cell function. How do you treat diabetes? You treat diabetes by weight control, by reducing your stress, by changing your diet, by exercise, and there are many Ayurvedic drugs. I have used many of them. They prevent the absorption, they slow down the GI tract absorption of glucose. That's how they work mainly. So it can be used because their mechanism of action, other drugs, they either replace the insulin because insulin is too high in the blood in type 2 and there is insulin resistance, it cannot work, so you have to supplement. Or you give some medicine to stimulate the pancreas to make more insulin. So they all work around pancreas. But this is one class of drug has nothing to do with pancreas. It has to work with the kidney. So, next please. This is how we look at the nephron. And it's a hyperfiltration taking place at the glomerulus, but proximal convoluted tubule reabsorbs 90% of the glucose. 10% is absorbed at the distal. Next please. So this is, no, to the previous one.
Beta पिछली side.
Yes. So it goes on. Urine glucose excretion is about 50 to 60 grams a day. Now imagine 1 gram of glucose has 4 calories. So you can calculate 80 times 4 is how much? बोलिए कितना है? पीछे से बोलिए. How many calories in 80 grams of glucose? 4 से मल्टीप्लाई करो भाई. सब लोग पास करके आए हैं. बड़ी मुश्किल वाला इम्तहान अब एडमिशन हुआ. तो anyway, बताया हमने कि 4 ग्राम 4 कैलोरी होता है 1 ग्राम में. मैं 80 ग्राम का पूछ रहा हूँ कितना हुआ है? आप आगे हमने सवाल पूछ ली है. हाँ, अब बोलिए. तो इतना कैलोरीज आप लूज कर रहे हैं विदाउट डूइंग एनीथिंग बाय टेकिंग दिस ड्रग, क्योंकि ये ब्लॉक कर देता है. It does not let it reabsorb. और reabsorption इतना देरी होता है 179 inhibition के कारण और ये फिर नीचे आ जाता है. Next please. So this is the same thing. Sodium and glucose both are absorbed, but the sodium is absorbed back and the glucose comes out and is lost in the urine. Next please. So it has a diuretic effect. It is synergistic with the other diuretics. So if you give other diuretics, you have to reduce the dose. Because if you cause too much diuresis, what will happen? The patient will get dehydrated and will end up in emergency room, getting intravenous. I used to scare the patients, telling them you'll get water from Lake Erie. It will give you, and they didn't want to hear that. So I told them, have 2 liters of water in the morning, finish it by the evening. In India, you have to drink 3 liters because this is a hot country. There is a different climate, 2 liters. So, cross reaction with the sodium hydrogen exchanger, increase in mitochondrial calcium and improve cardiac function. These are the effects of SGLT2, how it helps the heart I'm describing. Switch to myocardial substrate utilization from glucose towards free fatty acid. See, when the sugar is out of the body, what is the next fuel? Boliye? I'm prompting you, what is the next fuel the body has? The body can use protein for 3 hours, 50 minutes, maybe 60 minutes. Carbohydrate for another hour, hour and a half. 3 hours, it can use the fat. So when you start intermittent fasting, you stop eating at 6. By 9 o'clock, you have finished your meal. And after that, what's burning? Prompt kariye, boliye? Fat is burning. So you're losing weight all night, all morning, just hold back, don't have your breakfast. So, because heart uses keto, heart uses fatty acids, but fuel, it does not use glucose. So it's very useful. Lipid lysis takes place, it reduces the pericardial fat. So there is less fat, tightening up around the heart. Fibrotic mechanism, improve vascular function, improve ventricular vascular coupling, erythropoietin stimulation. Erythropoietin, you don't know what it is? Will you know? I want to be interactive. Will you आपको erythropoietin मालूम है क्या? Will you नहीं मालूम? हाँ, बोलना चाहिए ना? तो क्या फायदा कैसे सीखेंगे? जब तक ये पता नहीं चला कि हमको ये नहीं मालूम है, तब तक आप कैसे जानेंगे? So erythropoietin is produced to stimulate the bone marrow. It's produced by the kidney. So it promotes erythropoietin stimulation. So more red blood cells are produced. Blood becomes more efficient. आगे चलिए, next. So the SGLT2 inhibitors play a salutary role in heart failure by modulation of mitochondrial function. क्योंकि अभी तक ये हो रहा था, देखिए जितना भी हमने रिसर्च का भी कोट किया है, they are all 2021 and 2022 articles, including the one from September. Later, मैं बता रहा हूँ, this is the latest. The last 2 years में इतना change हुआ है इस field में, I cannot tell you. You have to keep up with it. So they produce sodium metabolism mediated carboprotective effect. These compounds could reduce the intracellular sodium overload. Furthermore, these inhibitors moderate the mitochondrial dynamics. It changes the functioning of the heart muscle. So this is just come out generally. Next please. What are the common side effects? ये जानना जरूरी है. क्योंकि अगर आप you don't know the side effects, the patients will hate you and leave you and find your neighbor. So क्या है? Urine tract infection. क्यों? Because the bacteria also love the sugar, just like I love the sugar. I had two rasgullas. So bacteria like that shit. They thrive if the sugar is there in the urine. Female and male genital yeast infection, because there is moisture in there and it's loaded with sugar. So the yeast also likes, so the yeast infection, if they get the yeast infection, you have to alert the patient, call me and I'll give you a suppository or I'll give you a tablet. So this is not something difficult to treat. It causes increased urination. बैठे हैं बाथरूम में, गए तो पेशाब करने तो आधा घंटा 15 मिनट लग गया, बार पेशाब हो रही और कुछ नहीं. लेकिन I want to tell you from experience, if the blood sugar comes down, this hyperfiltration stops. It's only there when the sugar is above the threshold, 180. So, joint pain, nausea, and all of this is, but this is very important. इसको हमने इसलिए पहले उसमें letters में डाला है. क्यों? You've heard of ketosis. Ketosis का मतलब क्या? कीटोसिस माने जब फैट बर्न करने लगता है तो कीटोन बॉडीज प्रोड्यूस होती है बॉडी में. तो अगर टाइप 2 डायबिटीज है, इंसुलिन की डेफिसिट हो गई तो फैट हैज टू बर्न, सो दैट यूरिक एसिड, दिस कीटो एसिड इज प्रोड्यूस्ड एंड दैट्स एसिडिटी. लेकिन when you take this medicine, the blood sugar is normal and you check it for ketone, urine will be very strong. So I used to tell my patients, if your urine starts smelling like rotten apple, you should get it checked for infection and ketone. There are ketone sticks available. I don't know if they are available in India. Ketone, just put it under the urine and it will turn the color into lavender and there is ketone. And so आपको फिर उसको दवा, you have to stop the medicine, hydrate them, give them some glucose, then they turn back to the glucose metabolism. Next please. So, in nephropathy, it was such a big hurdle because it caused some elevation of blood urea when I gave these patients, because there was dehydration. The nephrologist, the patient is going, no, Dr. Mishra doesn't know what he is doing, stop the medicine. It was very difficult to convince them, this is temporary and this is going to come down. So initiation was associated with reduced GFR, and that's how the temporary reduction. But the tests have shown that, this is the data from 2021, that if they have mild albuminuria, it improves. How does it improve? Because the hyperinfiltration which takes place in the glomerulus को बहुत मेहनत करना पड़ता है शुगर घटाने में. तो जब शुगर नॉर्मल रहेगी तो उतना मेहनत नहीं करना पड़ेगा. तो then they recover. The body heals by itself. Next please. So this is the data showing from 22, September 14th. अभी काल का पेपर 22. These data, red line, these are 18 months data of patients who are taking SGLT2 blockers. They are much better off compared to the ones taking the traditional patient treatment. Next please. So they as a class reduced. Now this is come out again August of 22. This data just came out 2 months ago. Reduces heart disease and Invokana possibly reduces both. Now this is not so accurate because this is meta-analysis. This is not direct head-to-head comparison of different drugs. So take it with a pinch of salt because the data has already proven wrong. But I want to show you that all these medicines, they all work same way. Next please. So they are step 2 therapy. Metformin, you start with type 2 diabetes, diet, exercise, all that with metformin. and when that doesn't work, but now I found out from my friends in Banaras that many patients, many doctors are using for weight loss. It's not recommended, but they are using first line because no other drug, all medicines for diabetes put on weight because you control the sugar better and the weight goes. And that's not good for diabetes. So, European Association also consensus statement says SGLT2 should be used after metformin. Recent ADA and European Association study consensus statement recommends after metformin. So, किसको नहीं दे सकते? Whom can you not give? If the patient has, like on a kidney machine, below 20%, इसमें तो 40% लिखा है, 20% किसी पेपर में ऐसा है. If the GFR is reduced below 20%, don't give it. Next is. So they work on intestines also, and ये दूसरा दिखा रहा है. That's the question I was asking that doctor about functional MRI. Because this paper, I'm not going to go into detail, shows that these drugs, they work on the hypothalamus and reduce the insulin resistance in the hypothalamus. So they affect the appetite. The weight loss takes place centrally also. Appetite reduction. Next please. So this is all the same paper. I see the audience is mainly MBBS first class, so that I'm not going to go into more details on this. Next please. Yes, next. Yeah, this is where what they did, they put insulin through the nose and gave also a drug through the nose, and they did a functional MRI. And that's how they said that the sensitivity changes by giving this drug. Next please. It needs to increase. Yes. So, I don't know about India, but I think, I have no idea how much they are using. But I've been told that a lot of use of this class of drugs. So this data basically shows that the VA study shows more people should use. Next please. Different inhibitors, I already told you, they have been approved, 4 or 5 of them in India. Next please. The newer inhibitor is also Mishra. Similar, all they are working different companies, the mechanism is more or less the same. Next please. Now, there is something else going on. Now we have found type 1, they want to use in type 1 also. It's prohibited to use in type 1 because it can cause ketoacidosis more common. So don't use it. Next please. Again, similar drug being introduced in India. Next please. Standards of medical care recommend that if you want to reduce coronary, किसी पेशेंट को हाइपरटेंशन हो गया डायबिटीज के साथ आप उसको दे सकते हैं कंफर्टेबल बिकॉज दैट्स अ कार्डियोवास्कुलर कॉम्प्लिकेशन. नेक्स्ट प्लीज. सो दीज आर ऑल डिफरेंट ड्रग्स कंपैरिजंस. नेक्स्ट टाइप 1 में इसको बताया, इसको कंपेयर करें उससे. देयर इज अनदर क्लास ऑफ ड्रग एक्सटेराटाइल by doing an injection through the city. I don't know if it is available in India, but now this is going to be available. Ribelsus. This is available over the counter. I mean oral. It reduces the appetite, works on the hypothalamus, and so it helps lose the weight and it reduces the blood sugar. Next please. And they compared to GLP-1 antagonist and SGLT2. SGLT2 has more efficiency. Next please. What about type 1? I told you don't use it. Next please. This is type 1 diabetes. How you should take care of it. What is the plan? I'm not going to go into that today. Next please. Conclusion. cheaper to prevent diabetes. Major cause of death is cerebrovascular cardiovascular disease. And these transponders, they increase urine volume, improve hypertension, fluid loss, helping with congestive failure, causing glycosuria, loss of calories, and reducing hyperfiltration, helping the kidneys. And now, this is what I put in the last point, that American Heart Association and American Cardiology Association just came out with a guideline last week that, look guys, only endocrinologists don't need it, the cardiologists can also use it. In congestive heart failure patients, you don't have to have diabetes to use this drug. This is brand new information. Next please. So, we are biochemists here, I thought I'll give you some food for thought. Look for Singaporean. I don't know if you know that, but I looked it up on the internet. That's the dandelion. That's the grass grown all over America. And it has a diuretic effect. So you guys get with your lab, find out what it has, find the actual active substance, and get a good price. Thank you. Next. Anybody has any questions, can make a note of my email address and call me. That's the issue. Diabetes per question nahi, I can't believe it.
What are the side effects of some of these, like glycoside? Are there any side effects on them?
किसका?
The glycoside.
अभी तो बताया सारा एक पेज में पूरा side effect है.
Can you just explain a little more? Can you explain a little more?
Side effects जो सबसे ज़्यादा आपको worry करना है. If you are taking two medicines, one of them is SGLT2 inhibitor, और दूसरी वाली कोई जो works on the pancreas to stimulate more insulin, तो एक को घटा देना है, क्योंकि hypoglycemia हो जाएगा उसमें. So if you are taking two drugs, the other drug has to be reduced. Hypoglycemia is a common one. Infections, urine में अगर burning होने पड़े, तो get a urine culture done. अगर vagina में कोई हो रहा है, secretion हो रहा है, fungus infection, they need antifungal. पानी खूब पीना, you have to drink a lot of water, and keep a nose close to the urine smell. If it starts smelling like a rotten apple, check for keto. Those are the main.
Contraindication, sir. Contraindication.
Contraindication बताया ना, ये patients who have total kidney failure, their glomerular filtration rate is less than 20 or 30%. उनको नहीं देना. Okay?
Below 30, sir.
Below 30, क्योंकि आपको यूरिन के थ्रू ये काम करता है. It promotes more urine flow. जब किडनी में से यूरिन निकल ही नहीं रहा तो कहाँ से काम करेगा? एक तो वो contraindication. टाइप 1 में नहीं यूज करना. और इसमें जहाँ तक कि ejection fraction है, cardiac ejection fraction, तो 60% नॉर्मल होता है. तो 40% तक, 35% तक है, तो आप ले सकते. It works very nicely with
Preserve वाले में सर, preserve.
हाँ,
Injection fraction.
इधर vascular उसमें strength होनी चाहिए. इजे अगर कम है तो this will work very nicely.
DK और HHS.
क्या पूरा बताइए. HHS हम नहीं जानते.
सर डायबिटिक कीटोसिस में.
कीटोसिडोसिस में तो देना ही नहीं है.
देना नहीं है.
बताया ना कि कार्ड
हाइपोरोस्मोलर सर, हाइपरग्लाइसीमिया.
हाइपरग्लाइसीमिया का ट्रीटमेंट ये नहीं है. उसका ट्रीटमेंट है पानी चढ़ाओ उसको हाइड्रेशन की जरूरत है. हाइपरऑस्मोलर उसको होता है बुढ़ापे में ज़्यादा होता है या नर्सिंग होम में, पानी के पास नहीं जा पा रहे हैं और शुगर बढ़ी हुई है, पेशाब होती जा रही है और कोई घर का बंदा कोई नहीं है उनको पानी देने वाला. तो उसमें ड्राई डिहाइड्रेशन, उसमें हाइपर हाइड्रोसिस हो जाती है, हाइपर ऑस्मोलरिटी. यस, यू आर स्टूडेंट ऑफ व्हाट? अच्छा, नहीं तो अभी तो फर्स्ट ईयर वाले हैं. रेजिडेंट. दैट्स गुड. आई एम ग्लैड टू Yeah, question.
Sir, I have a question. Normal person, I am not diabetic. I'm a normal. I am taking this pool inhibitor, SGLT2 inhibitors. What is going to affect? What are the effects?
आप काहे कोई सब चक्कर में पड़ रहे हैं? इसको मत करिए, हमने आपको बहुत साफ बता दिया, इंटरमिटेंट फास्टिंग। चीता इज हियर नाउ, चीता। आप 6 बजे,
चीते को अपने पीछे रख देता हूँ, आगे भाग जाता
10 बजे के पहले मत खाइए और 6 बजे शाम के बाद खाइए। आपको कुछ करने की जरूरत नहीं, पानी खूब पीजिए और आधा घंटा रोज टहलिए, वो पेट और सब बढ़ जाएगा।
लेकिन मैं बैठता जाता हूँ, वो सारा काम करता हूँ कि बैठता मैं बहुत ज्यादा
तो घर कितना दूर है? घर यहाँ से बगल में, क्योंकि आप चक्कर में लगा के देखिए सब पेड़ में पानी है कि नहीं। तब आपका सब पूरा वॉकिंग
मछलियाँ भी पाल रखी हैं, देखता हूँ पानी
I did not attend your lecture, I just now came here. I had one.
ये slides हैं सब, you can take those slides.
I want basic question is that what is the actual range of whether you are diabetic or not? Actually, sometimes.
सारी रामायण खत्म रही, सीता कौन थी?
No sir, because sometimes it is said that कि ये जो है फार्मेसी का प्रोपेगेंडा है कि 7 से।
बात ये है ना कि यहाँ कोई एजुकेटेड फार्मेसी का टोटल लगाम उस पर है ही नहीं है। वो कोई भी बिठा दो फार्मेसी में बैठ गया, मतलब ये तो यहाँ पर बिल्कुल क्या बोल रहे हैं, आई डोंट वांट टू से। तो क्राइटेरिया ये है, मैं बता रहा हूँ आपको। फास्टिंग ब्लड शुगर शुड बी बिलो 100। ओके, फास्टिंग अगर 100 to 125 है तो दैट इज प्री डायबिटीज। फास्टिंग अगर 125 से ज़्यादा है तो दैट इज डायबिटीज। ये तो फास्टिंग का हो गया, बट यू विल मिस मेनी केसेस इफ यू जस्ट गो बाय फास्टिंग। यू हैव टू डू पोस्ट पेरेंटल। तो आप 2 आवर्स का पोस्ट पेरेंटल करिए, 75 ग्राम ग्लूकोज, तो उसमें 140 के नीचे नॉर्मल है और 140 से 200 तक प्री डायबिटीज, 200 के ऊपर डायबिटीज। दिस इज द क्राइटेरिया फॉर डायबिटीज एंड प्री
कुछ
डायबिटीज।
पैथोलॉजी लेवल है सर जो है वो 100 की बजाय 110 लेते हैं नॉर्मल में।
ये तो मनमानी है।
मतलब
हाँ सर, इसीलिए
जो
हम
range है,
WHO criteria
WHO क्राइटेरिया सारे यूरोप में, सारे अमेरिका में यही फॉलो होता है। WHO ठीक है, आई डोंट वांट टू से मोर, क्योंकि उनको बहुत कॉम्प्रोमाइज करना पड़ता है।
सारा दुनिया का देख के
सारे दुनिया का देख के सबको डायबिटीज डिक्लेयर करके सब लोग अपने ढंग करके चेहरा बैठ गए तो ठीक नहीं लगता है।
सर एक और क्वेश्चन है कि जैसे मेरा यूजुअली, मैं भी हूँ डायबिटिक, तो फास्टिंग मेरा ज़्यादा आता है, बट पीपी 2 घंटे के बाद देखते हैं तो फास्टिंग से कम हो जाता है।
दवा कौन सी खा रहे?
स्टैटिक खा रहे हैं कोई?
नहीं, बट मेडिसिन आई थी।
स्टेटिन तो वो बीच में खाया था, बट अब नहीं। सर यूडापा
क्या होता है?
सर वो ब्रांड नेम है
डापा होगा सर, डायबिटीज ट्रांसपोर्टर SGLT2
हाँ, उसमें उन्होंने भी वाटर इनटेक ज़्यादा कहा है। एंड दूसरा मेटफॉर्मिन सर,
तो मैं बता रहा हूँ, फास्टिंग ब्लड शुगर बढ़ने का मतलब है कि आपका लिवर रिलीज कर रहा है शुगर। फास्टिंग इज कंट्रोल्ड बाय योर लिवर। व्हाटएवर ग्लाइकोजन यू स्टोर ड्यूरिंग द नाइट, दैट इज रिलीज्ड ऑल नाइट टू टेक केयर ऑफ इट। तो अगर फास्टिंग ज़्यादा है तो लिवर से उसमें मेटफॉर्मिन नहीं, तो आप छोड़ दीजिए सर। आप सवेरे लोग चक्कर लगाइए, क्या घर में बैठ करके बायोकेमिस्ट्री की खाली लैब में बैठिए। सवेरे आप घूमिए 1 घंटा, तो सब ठीक हो जाएगा। या तो रात को खाने के बाद घूमने जाइए, तो वो पोस्ट पेरेंटल नीचे ले आ जाएगा, तो फास्टिंग आपका ठीक
सर
है।
HbA1c 6.7 आफ्टर टेकिंग मेडिकेशन इज
नहीं, वो तो ठीक है, वो हो रहा।
HbA1c कितना है?
6.7।
हाँ, दैट इज ओके। 7 के नीचे बोलते हैं, अमेरिकन डायबिटीज एसोसिएशन से बिलो 7। लेकिन उन लोगों ने कॉम्प्रोमाइज किया। अमेरिकन एसोसिएशन ऑफ क्लिनिकल एंडोक्रिनोलॉजी से 6.5। आप जाइए क्लीवलैंड क्लिनिक का, और स्ट्रिक्ट क्राइटेरिया। आप बस अपने घूमने पर चक्कर लगाइए, 1 घंटा घूमिए शाम को और वहीं पर रट्टा लगाइए अपने लेक्चर का।
थैंक यू।
So that's it.
And sir,
Sir, as we know, as we have already said, it prevents the major CV risk. SGLT2 inhibitors prevent the CV risk. But how does it have impact on microvascular complications also?
नहीं, देखिए माइक्रोवास ये दवाई जितनी आई है, आपको बताया हमने 2008 में आई और 2-3 साल लग गया उसको एक्सेप्ट होने में। तो अभी ये माइक्रोवास्कुलर पे इसका इफेक्ट मेनली है। माइक्रोवास्कुलर का तो उसमें हम निकल के आया है, जो पहले लॉन्ग टर्म ट्रायल हुआ था कि उसमें टाइप 1 टाइप 2 दोनों का ऑक्सफोर्ड जो इंग्लैंड में जो स्टडी हुई टाइप 2 की थी और अमेरिका में 1400 पेशेंट्स की जो थी वो टाइप 1। तो माइक्रोवास्कुलर इज रिड्यूस्ड बाय ब्लड शुगर कंट्रोल, बाय कंट्रोलिंग ब्लड शुगर A1C, और आप बस इस पे 2 बार हाइपरटेंशन कंट्रोल करिए। दैट्स द प्राइमरी प्रिवेंशन फॉर माइक्रोवास्कुलर, नथिंग टू डू विद दिस।
Thank you, sir. Thank you very much for your enlightening
Thank you.
lecture. So big round of applause for everyone.